data. First, a few days does not represent a trend. We've said that many times. And we have seen the data bounce around over the course of more than a few days. Second, the number of positive tests is entirely dependent on who gets tested. And what I mean by that is the daily test totals don't represent necessarily what's happening across the entire Commonwealth. For example, we've prioritized testing for nursing homes and hotspots, which obviously affects the number of positive tests we get when we test. One piece of data that we watch very closely is the number of hospitalizations for COVID-19, and we are still seeing an increase here. On personal protective equipment, we were pleased to receive 400 ventilators from New York on loan. We reached out to Governor Cuomo's office in New York last week. They're on the other side of the surge, and they were kind enough to lend Massachusetts this life-saving equipment during our surge, and for that, we are enormously grateful. As of yesterday, we've delivered over 5 million pieces of personal protective equipment, and our command center is communicating daily with hospitals and medical professionals around the Commonwealth to monitor the capacity of our hospitals. As of the end of the day yesterday, there were approximately 18,100 available beds statewide. Approximately 3,800 beds are occupied for patients with COVID-19. About 10,300 beds, or about 53% of our beds, 58% of our beds overall, remain unoccupied and available for patients. Those empty beds include about 6,800 acute care or non-ICU beds, approximately 2,600 ICU beds, and 900 beds at our field medical hospitals, although we do anticipate that hospitalization rates may increase in the coming days. As I've said before, this is an insidious virus, and it puts our doctors, our nurses, and our other frontline medical staff to the test. But thankfully, we have some of the greatest healthcare providers in the world here, and we have all worked enormously hard to prepare for this. Many hospitals have reported a reduction in patients seeking care for other serious medical conditions, like heart problems and cancer treatments and kidney dialysis. It's important to remind the public that our hospitals have made accommodations for COVID-19 to ensure that they can also care for other healthcare problems. People should still call their doctor to talk about their own health and their own health care and go to the hospital if they have an emergency. We worked hard to set up a telehealth program for people so that they could more easily connect with their healthcare provider, and many people are doing that. And Buoy.com, which is a Massachusetts-based company that gives people the opportunity to diagnose online using their artificial intelligence tools, have actually served at this point over 90,000 people. And there have been people in cases where they've worked through the system where their recommendation has been to call 911 and to go get the health care that they need. Please, use the system. We worked really hard to make sure that it would be there for you if you had an issue or a problem that had nothing to do with COVID-19. If you don't feel well, please contact your clinicians, engage, and be involved in making sure that your health care needs are taken care of. Call 911 in an emergency and get to a hospital if you need immediate medical help. We don't want people getting sicker or exacerbating an illness or an injury because they have concerns about the healthcare system's ability to meet their needs. Folks are there. Folks want to serve. That's what all this preparation was all about. Today, with respect to schools, today our administration is announcing that all public and private schools will remain closed through the end of the school year. Remote learning will continue in all districts. This does not apply to residential special education schools. This is a big decision, and the Lieutenant Governor and I have spent tons of time talking with Secretary Jim Pizer, Commissioner Jeff Riley, and many of our leaders in local communities about this decision across the Commonwealth. It's the right thing to do considering the facts on the ground associated with the COVID-19 pandemic. And at this point in time, there is no authoritative guidance or advisories with respect to how to operate schools safely and how to get kids to and from schools safely. We believe students, therefore, cannot safely return to school and avoid the risk of transmitting this virus to others. As we've said before, closing the actual school buildings for the year does not mean It's time to start summer vacation early. We're making this decision to allow school districts to plan through the end of the year to offer remote learning for all students. This includes students with special needs and English language learners. Massachusetts is home to some of the brightest students in the nation, and this pandemic has upended their lives as well. Being away from their friends, their teachers, their sports, and other important resources, for many of them, all of them, has been a terrible loss. School administrators, principals, and teachers have worked hard to create curriculums and materials and to help their students keep learning at home under these very difficult circumstances. We appreciate how challenging it is to be apart from your students and still find ways to keep them motivated and committed to their studies. The Department of Elementary and Secondary Education is taking additional steps to boost remote learning efforts for the remainder of this school year. The department will start preparing for summer learning, especially for students at risk of falling behind grade level, to ensure a strong start for all students in the fall.